Another type of proteinuria could be the overt type of proteinuria. Now, I'm trying to reason the overt type of proteinuria literally. You could say that anything that is overt is more of like it is obvious. Anything that is overt is obvious. Okay, so this type of proteinuria is that it is obvious. You can just carry the urine and see it. Okay, it's obvious. So we'll talk about it from the definition to the causes. We'll talk about it to the symptoms, talk about it to the diagnosis, treatment, and prognosis. So for the definition, we say that overt proteinuria is a condition which is characterized by a presence of large amounts of protein in urine. And these protein levels will exceed about what? 500 milligrams per day. Okay, so you'll be having about 500 milligrams proteins in your urine per day. It is a sign of kidney damage or disease. Talking about the causes, what could make proteins be so obvious in urine like this? Could be due to glomerular disease like what glomerulonephritis or membranous what nephropathy. Could be due to what diabetic nephropathy. Could be due to hypertensive nephrosclerosis. Could be due to chronic kidney diseases. Could be due to kidney damage from toxins or medications. Could be due to infections from what? Infections like pyelonephritis and cancer. That's multiple myeloma. Then symptoms is if you're having obvious proteins in urine like this, your urine will be foamy and frothy. Okay, there'll be swelling, that's edemas in the feet and legs. There'll be fatigue, weakness, there'll be weight gain. That means the person will be now obese and all that. Not really obese though, but the person will be big. Okay, then that is good due to edema, right? High blood pressure, there'll be decreased urine output. Then for diagnosis, you might want to do a urine protein to creatinine ratio test, then a 24-hour urine collection test, a blood test, okay? Blood test like what? Serum creatinine and albumin. Then you might want to do kidney biopsy too. Treatment. If there's any underlying something that is causing the condition, try to address it. Okay, so address underlying causes, control blood pressure and blood sugar, reduce protein intake, then use diuretics if you're having some edema. Then you might want to give some angiotensin converting enzyme inhibitors or angiotensin receptor blockers just to slow down the kidney damage. Prognosis is it varies depending on the underlying cause and severity. Early detection and treatment can slow down the disease condition. All right, and if you don't treat it quickly, it might lead to what? The chronic type of kidney diseases, and you don't want this. So that's it for overt proteinuria.